Michelle ASMR. Hello, how are you today? Good, take a seat, make yourself comfortable. My name's Sophie and I'm going to be performing your treatment today. Thank you so much for joining us here at the Dermatologist Spa Clinic. Have you been here before? Okay, so you're just starting your first round of treatments. Great. If you don't mind, I'm just going to jot down a little bit of information, if that's okay. Great. I always have a really fancy sparkly notebook of some sort. Okay, so if I could just get your first and last name. And your date of birth. Okay, and a contact number for yourself. And a next of kin contact. Yep. Okay, great. So what exactly is it that we're treating today? Okay, so we're doing red light acne treatment. Amazing. So have you ever had any sort of acne treatment before? No? Okay. Have you previously been to your doctor about acne? Okay. You've been on... Okay, so you've taken like the acne, what's it called? Acne side? Yeah, like the cream. Yeah. It's like a very gentle bleaching cream. Okay, and how did that fare? Just got very dry skin. Yeah, that is something that happens quite a lot. A lot of the time actually people can have that sort of treatment and it works great for about 2 years, and they come off the treatment and then it just goes back again. So unfortunately, if you tend to have acne prone skin, it is something that you're just going to have to battle with. But of course treatments like this can help a lot, and as long as you keep up with them, then usually we can sort of manage the acne. So when did the acne start? Okay, so it's more adult acne. Yeah, so that's been 4 years. Yeah. Okay, and where is most common that you find yourself getting acne? Okay, so the chin area and around the nose. Same. Chin area and around the nose. Okay. Do you notice it's more to do with hormones? It's hormonal acne, so they come up as like cysts underneath the skin. Yeah. And just a few sort of upkeep questions. So, are you using a cleanser morning and evening? And what cleanser are you using? Okay. How about other skincare products? Okay. How about an SPF? Okay. So today I'm going to be prepping your skin before we do the treatment anyway. So I'm going to be using a range of products that I would recommend to you. I can give you some samples to take home to try. They are on the rather expensive side, so you sometimes can find alternatives to these products that might be a little bit on the cheaper side. But generally this is the sort of thing that you want to be going for. Okay, so we'll pop an SPF for you as well. I do suggest that you wear at least an SPF 30 all the time. Even if it seems like it's really cloudy outside, the UV rays can still get through. Okay, and how about makeup? About 5 days a week. So usually for work, yeah. Okay, that's no problem. So if you've got makeup on today, if you've just been to work, yeah, that's fine. That happens actually quite a lot. So what I'm going to do first is I'm going to give your skin a nice prep and cleanse. We're going to start with a pre-cleanser to remove all of that makeup. Then we'll go in with a gentle cleansing gel, followed by a daily exfoliant, and then we'll be finishing with a pore reducing mist and a SPF, and then we'll start with the red light treatment. Okay, sound good? Wonderful. Okay, let me just get prepped and ready, and then we'll begin. Okay, so I'm going to start off by just popping a little headband on you, just so I can remove your hair out of the way. Nice and comfy. Great. Okay, so I'm going to start with the pre-cleanse, which is basically like a cleansing oil, and it's just going to break down all the makeup and make it very easily to remove. Okay, so here's our pre-cleanse. So I will give you a few of these just to take. Just open it up. Okay. And just pour it out. You can see it's just a nice oil. Just going to work that in between my hands. Apply that to your skin. So let's just remove that. Okay, so now let's remove that. This is just wiping away all the makeup on your face so that I've now got a nice clean base to deep cleanse. I think that should do. Okay, so now we're finished with the pre-cleanse. We're going to move on to the deep cleanse. So this is the special cleansing gel. So this is a soap-free foaming gel that cleanses all skin conditions. It contains naturally foaming collagen, saporia, saponaria. Gently rinses away toxins and debris, leaving the skin feeling smooth and clean. Features balm, mint and lavender extract to soothe. Okay. So you're just going to take just a pea-sized amount. I'm just going to lather that up in my hands and just cleanse your skin. Beautiful, and then let's just rinse that off. Taking a new cloth, just removing that cleanser. Wonderful. Okay, so we'll just finish with a pore mist and an SPF, and then we'll begin with the actual treatment itself. Okay, so here we have our micro pore mist. This minimises visible pores and reduces excess oil with vitamin B3, helping to brighten the skin and even the tone. It also has witch hazel, green tea and cucumber extract to refresh. Okay. So I'm just going to spray this. Close your eyes. Wonderful. Okay. And then the SPF. The SPF we have here is a broad spectrum sun cream that is oil free. This one is an SPF 30. Okay. So again, you just need a very, very small amount. Just a little pea-sized amount. Okay, I'm just going to again moisturise that into my hands and apply it to your face. Okay, so we're ready to begin the red light treatment now. Okay, so here's what we're going to be using today. This is the Neutrogena Red Light Pen. What this does is it directly targets the breakout areas, getting underneath the skin using red light therapy to prevent the future production of any bacteria underneath the skin. So what I'm going to be doing is I'm going to be assessing your skin, pointing out an area that needs the red light therapy, and then we'll be placing this directly onto the area for 2 minutes at a time. It times it itself. Okay, so let me just have a little assessment of your skin. So I think we have about 5 or 6 areas that need treating. We've got just one here, right above your eyebrow, and then we've got about 1, 2, 3, 4 around your chin. Okay, so it'll be about 10 minutes if that's okay. Wonderful. Okay, so you relax and we'll start with the treatment. Okay, so just turn it on. We'll just start with the one above your eyebrow here. It should feel a little bit hot, but nothing too uncomfortable. Just let me know at any time if you want me to stop, okay? Okay. Just my hand it might take a little bit, so I'm just going to switch between hands if you don't mind. You're doing really well. Is it not hurting? No. Good. So it's sort of like a tricolour of lights. We have 2 blue lights. Oh, there we go. So we have 2 blue lights and 1 red light in the centre. So have you had any other sort of skin treatments? Okay. So you're quite a facial person. Nice. I personally really love microdermabrasion and dermaplaning as well. In fact, I really desperately need to have a dermaplaning appointment soon because I'm applying makeup easier, I guess. Just use my other hand here. Here, and then if you have had microdermabrasion. So it's like a little, if you can imagine a teeny tiny little paint roller with loads of tiny little needles on it all around the circle, and you basically roll the skin with these needles and it punctures the skin, causing it to swell slightly, and it helps with blood circulation. It can be really, really great for acne scarring, any sort of scarring on the face. Okay, 3 more, one just here. Yeah, you can do it at home yourself, but it's usually preferred if somebody does it for you, just purely because you need to know the correct amount of pressure to use. You don't actually want to fully puncture the skin, you just want to slightly indent it. It's almost like causing a very, very gentle trauma, so getting a very, very small bruise. You see the blood come to the surface of the skin. However, that severely, but you want to promote blood going to that place. Also promotes cell regrowth, so it's good for sort of aging process. Sorry, I know that this can be a little bit boring. Just use my hand. So, do you have any plans at all for the rest of the day? Okay, I see. Oh well, I hope you enjoy. Are you starting to think about going on holiday yet? I've had a lot of clients be like, I need to get everything sorted. I need to get my treatments booked in well in advance of my holidays. Everyone's been booking their eyebrows and eyelashes in, getting them done. Oh well, I can certainly book you in if you want. We can do them both at one time if you'd like. Yeah, of course. Okay, I'll make sure that we do that at the end of the session. Nearly done now. Just this and then one more. You're actually looking quite good. Your skin's looking pretty clear. I can just see some slight ones under the surface. Is that what tends to bother you? Yeah, it's sort of those cysts, isn't it, where they get underneath the skin and they don't quite come to the surface, so they're not so easy to get rid of and manage. It's more of a problem with the bacteria really deep inside the pore. Okay, nearly done. One thing, it makes my arms ache doing this treatment. would usually have you in the proper treatment room where you're lying down. On the bed. One more, just here. But somebody's currently having their eyebrows done, and of course we need that to be lying down. Whereas this I can do standing up, so that's fine. So where are you planning on going on holiday then? Okay. Yeah, a lot of people are still sort of scared to book, I think. We've booked, but we've not booked until like late 2022. Just because we don't know what the sort of situation's going to be like. Especially as we're going to be going to Florida. So, obviously, I think the sort of atmosphere and everything is different if you've got to wear masks and things. So hopefully things have quieted down a little bit by then, but we'll just see. It's not the end of the world if not, but it'd just be nice, especially with the heat. Wearing a mask, I can't even imagine. I think that's the blessing about living in the UK, isn't it? It's even in the height of summer, we're still only hitting 26 to 28 degrees. We might get to 30, but it's rare. And usually where are you going that's, where you need to wear a mask outdoors? It's quite a rare occasion, isn't it? Yeah. Well, exactly. I couldn't imagine sitting on a beach, could you, with your mask on? Okay, so that's all done. They may just feel a little bit tingly and irritated for a couple of hours now. Maybe you might get a little bit of a hot sensation sort of staying in those areas. Just make sure to keep the areas clear. In fact, I would advise you not to wear makeup for the next 24 hours if possible. I'm going to give you a sample of all the products that we've used today so that you can take them home and use them. I'll give you about 3 or 4 days worth. No problem, it's fine. If you are interested in the products, then feel free to phone us up here at the clinic and you can get them sent straight to your door at full size. Alright, wonderful. Okay, so let me just remove that headband from you. There we go, thank you. Okay, so if you want to just follow me and we'll get your eyebrows and eyelashes booked in.